Colon cancer, also known as colorectal cancer, is one of the most common cancers worldwide and a leading cause of cancer-related deaths. It begins in the colon or rectum and typically develops over several years, often starting as benign polyps that may gradually transform into malignant tumors. While it can affect anyone, certain risk factors such as age, family history, lifestyle choices, and diet can significantly increase the likelihood of developing the disease. Early detection of colon cancer is crucial for successful treatment and improved survival rates. In fact, when caught at an early stage, colon cancer is highly treatable and often curable. However, many people miss the early warning signs or dismiss them as minor issues. Because the symptoms can be subtle or mistaken for other common digestive problems, colon cancer often goes unnoticed until it has progressed to a more advanced stage. In this video, we will highlight the early warning signs of colon cancer that should not be ignored. By understanding these symptoms, individuals can seek timely medical advice, potentially leading to earlier diagnosis and better outcomes. Awareness is a powerful tool in the fight against colon cancer, and recognizing these signs can help save lives. Before we move on, a quick reminder. The information in this video is for educational purposes only and should not replace professional medical advice, diagnosis, or treatment. Now, let's continue. Gastrointestinal symptoms are often the most prominent and early signs of colon cancer. Many patients experience changes in their bowel habits, such as persistent diarrhea or constipation. These symptoms are common digestive issues, which is why they may not raise immediate concern. However, if these changes are prolonged or occur without a clear cause, they could indicate a more serious underlying issue. Colon cancer can disrupt the normal function of the intestines, leading to irregular bowel movements. Individuals may notice that they frequently alternate between diarrhea and constipation, which is not typical for their usual digestive health. Another notable symptom is the presence of blood in the stool or rectal bleeding. This can often be mistaken for hemorrhoids, which is why it is frequently ignored. However, blood in the stool can appear in different forms, such as bright red blood or darker tarry stools, depending on where the cancer is located within the colon. Rectal bleeding can be a strong indicator that something is wrong, and it should not be overlooked. Additionally, individuals may notice changes in stool consistency or color. For example, the stool may become narrower than usual or take on a different color. These changes are subtle but can signal a blockage or growth in the colon that alters the passage of stool. Persistent abdominal discomfort is another common symptom of colon cancer. Patients may experience cramps, gas, or bloating that does not seem to resolve. This discomfort can result from tumors growing in the colon, which may cause a partial blockage, leading to pain and pressure. Abdominal discomfort associated with colon cancer is often persistent and does not respond to over-the-counter medications, which can differentiate it from more benign digestive issues. If abdominal pain is coupled with other symptoms, such as changes in bowel habits or blood in the stool, it is essential to consult a healthcare provider for further evaluation. Unexplained weight loss can be a troubling symptom that signals colon cancer. Weight loss in this context is not due to intentional dieting or exercise, but rather occurs without any apparent reason. Cancer can alter metabolism, causing the body to burn calories at a faster rate than normal. Additionally, tumors can release substances that interfere with how the body processes nutrients, leading to muscle loss and a reduction in body fat. For individuals who experience significant weight loss without making any lifestyle changes, this can be an indication of an underlying medical issue, such as colon cancer. Chronic fatigue is another symptom commonly associated with colon cancer. Fatigue from cancer is different from ordinary tiredness. It is a persistent feeling of exhaustion that does not improve with rest. This type of fatigue may result from the body diverting resources to fight the cancer cells. or it can be due to the tumor causing blood loss, leading to anemia. Iron-deficiency anemia is frequently linked with colon cancer, as the disease can cause small amounts of blood loss over time. The symptoms of anemia include tiredness, weakness, and a general feeling of being unwell, which can contribute to the overwhelming fatigue experienced by those with colon cancer. In addition to weight loss and fatigue, anemia-related symptoms can be particularly concerning. Anemia occurs when the body does not have enough healthy red blood cells to carry oxygen to tissues, leading to symptoms like dizziness, shortness of breath, and a pale appearance. Colon cancer can cause slow, chronic blood loss that may not be immediately obvious, but leads to a steady decline in red blood cells. For individuals who experience a combination of these symptoms without a known cause, it is critical to seek medical advice to rule out conditions such as colon cancer that may be causing these signs. Persistent abdominal pain and bloating are often overlooked as potential signs of colon cancer, as they are common symptoms of many less serious digestive conditions. However, when abdominal pain does not resolve with typical over-the-counter remedies or dietary adjustments, it could be a red flag. Colon cancer can cause pain that varies in intensity, ranging from a dull ache to sharp cramps. The pain may be intermittent at first, but often becomes more constant as the tumor grows. Pain is commonly felt in the lower abdomen, but it can also radiate to other areas, making it difficult to pinpoint the source. Bloating is another symptom that can be indicative of colon cancer. When the intestines are obstructed by a tumor, it can lead to a buildup of gas and bloating. Patients may notice that they feel unusually full or that their abdomen appears swollen, even after eating a small amount of food. This sensation of bloating can persist despite taking antacids or making changes to their diet. Bloating from colon cancer is often accompanied by a change in bowel habits and may worsen over time, particularly if the tumor continues to grow and obstruct the intestines further. These symptoms are particularly worrisome when they occur together or in conjunction with other signs of colon cancer. For instance, a person who experiences persistent pain, bloating, and changes in stool appearance or frequency should consider seeing a healthcare provider for evaluation. Persistent abdominal discomfort that does not have a clear cause can sometimes be a sign that the tumor is blocking or narrowing part of the colon, a situation that can become dangerous if left untreated. Recognizing and acting on these symptoms can lead to earlier diagnosis and a better chance of successful treatment. Changes in the frequency of bowel movements are common indicators of colon cancer. People may notice that they are going to the bathroom more often, or conversely, that they have become constipated. While many factors can contribute to changes in bowel movement frequency, such as diet and stress, prolonged changes can indicate an underlying issue. Colon cancer can disrupt the normal rhythm of the bowel, leading to either diarrhea or constipation that lasts for more than a few weeks. Chronic diarrhea may occur as the cancer interferes with the colon's ability to absorb water from the stool. This results in loose or watery stools that persist despite dietary adjustments. On the other hand, constipation can be caused by a tumor physically blocking the passage of stool through the colon. When a tumor grows, it can partially or fully obstruct the bowel, leading to significant changes in bowel movements. People with colon cancer may find themselves unable to pass stool regularly or may feel that they cannot fully empty their bowels. Additionally, individuals may experience alternating episodes of diarrhea and constipation, which can further complicate the diagnosis. This pattern, often referred to as constipation diarrhea syndrome, is a hallmark of bowel obstruction caused by colon cancer. If these changes in bowel movement frequency are accompanied by other symptoms such as blood in the stool, abdominal pain, or unexplained weight loss, it is essential to seek medical evaluation. Chronic or recurrent issues with bowel movements that do not improve should never be ignored, as they may point to the presence of colon cancer or other serious gastrointestinal conditions. Iron-deficiency anemia is a condition where the body lacks enough iron to produce sufficient hemoglobin, the molecule in red blood cells that carries oxygen. Colon cancer can lead to chronic blood loss, especially when tumors in the colon or rectum bleed. This blood loss may not be visible, as it can occur in small amounts over time and go undetected in the stool. As the blood loss continues, the body's iron stores are gradually depleted, leading to anemia. Iron deficiency anemia is often one of the first signs of colon cancer, particularly in older adults, as it can develop before any other symptoms become apparent. The symptoms of iron deficiency anemia are subtle but noticeable. Individuals may feel unusually tired, weak, or short of breath, even when engaging in light activities. Other signs of anemia include dizziness, pale skin, brittle nails, and a rapid or irregular heartbeat. These symptoms occur because the body is struggling to deliver enough oxygen to its tissues. In cases of colon cancer, the anemia is usually persistent and may not respond well to iron supplements, as the underlying cause is ongoing blood loss rather than a simple dietary deficiency. Because iron deficiency anemia can result from a variety of causes, it is important to investigate the source, especially in individuals who are not prone to anemia due to factors like menstruation or dietary habits. In older adults or those with no clear reason for anemia, healthcare providers may conduct tests to identify the underlying cause, including checking for colon cancer. Recognizing the link between anemia and colon cancer can lead to earlier detection, which is essential for improving outcomes and reducing the risk of the cancer progressing to an advanced stage. Recognizing the early warning signs of colon cancer is essential for prompt diagnosis and successful treatment. Although the symptoms of colon cancer can be subtle and easily mistaken for minor digestive issues, being aware of changes in bowel habits, unexplained weight loss, persistent abdominal discomfort, and other indicators can lead to earlier detection. By paying attention to these warning signs and seeking medical advice when symptoms persist, individuals can take control of their health and potentially improve their chances of a positive outcome. Colon cancer is a serious disease, but it is also one that can often be prevented or caught early through regular screening. Understanding the risk factors and making lifestyle changes, such as adopting a healthy diet and staying active, can reduce the likelihood of developing colon cancer. Additionally, those with a family history or genetic predisposition should prioritize screening and be vigilant about any symptoms that may arise. Awareness is a powerful tool in the fight against colon cancer, and by recognizing these signs, individuals can take proactive steps to protect their health and increase their chances of successful treatment.